body and mind. So I wanted Dr. to support me and to reduce this caffeine. I don't use medicines. I know Gandhata like that medicines are very nice and excellent action. I won't stand on problem. So with this technical, I am expecting more better results.
Please bring this small table. On this bag, please. One more lady, please. A lady. Yes, just help me or help her. Anyone.
So this is actually the session is how to Har Ghar Ayurved. So we are just popularizing Ayurved. Har Din Har Ghar Ayurved. So this session is also live in the Facebook as well as after some time it will be also live on the YouTube. And many of the participants will join virtually. I welcome all of you. Marker pen, I think marker pen is also there. You can find marker pen from here. So this is a live session on the
that should be here. Okay. Just tell me where is your maximum paining area?
you can take the mic also.
Yes.
I think the light should be light. This light. This light. This light.
Can anyone can anyone off this AC? Can anyone off? Hello. Yes. We are performing. 1 minute.
I think that there is one issue with the camera. 1 minute.
Just a minute.
इसको पकड़ ले आप.
Okay. उधर ले जाओ कैमरा ना कैमरा just camera take the camera just 1 minute
Can I just?
okay
Madam, you are feeling something hot. Then I will stop. Okay. Yes. Do you feel any hotness? Yes. Do you feel? Yes. Okay. Do you feel hotness? Okay. Yes. Yes. Okay. This is the exact way of doing Agni Karma. Yes, okay. Oh, very hot. Yes, take deep breath, take deep breath, take deep breath. Okay. We are doing this Agni Karma over here. Now, just wait for 5 minutes, then see answer what is the relief.
So what is the case?
Where were you when she was explaining everything?
Where were you? So what
Where
are the
were you?
points you have located, son?
I have already explained everything. I have already explained everything. Where she was having pain, I using marker pen. I was using marker pen for the site. I selecting the Agni Karma points, and then we perform Agni Karma over that point. When she was explaining everything, I think you were not here.
No, sir, not like that. She had pain in the lumbar region. She said she got anesthesia for long hours. You took points.
Right. She was having a block. Now, what is your feeling?
Heaviness I lost. Heaviness I lost. Pain also, and during the process, I felt feeling very better. Pain or suffering during the process. He was passing through the back. That time I felt some miracle was happening.
Okay.
No, at present, no worries.
Pain and heaviness also I lost.
What she is explaining, I think you should listen carefully. This is patient's confession after the treatment. So you do not miss it. Listen what she explains her experience.
Whenever the salaka was heating and touched my body, then itself I feel I felt that heaviness was lost, and then I feel movement is very free. Otherwise, I have to move, but very heavily and painfully. I have to do my work at my place. But now I'm feeling very much better.
Sitting and after kindly check what's the pain somewhere.
Not problem for me.
Bend
No
down.
problem. I can sit.
She was feeling heaviness in her back.
I do yoga every day.
Because of the procedure, which is lumbar anesthesia, where there was a great spasm in her muscles. Okay, got the point now. That is why she feels heaviness in her back. We have removed all the heaviness. You can perform this on your own with the help of any doctor.
Sir, how many times one you can?
Yes. So I think there is a candle in your home. There is a shalaka in your home. This is basically children using the body. I know. For hand. Okay. So you bring it. Just it is for about 550 rupees. It gives you 4 shalaka. It gives you 4 shalaka. You can use it afterwards on your patients. Okay.
Sir, what material of the
Silver. You can use gold.
1 minute
You can use gold also. Ideally, we are using silver shalaka. Then we are using lower shalakas. Lower shalakas. Okay.
How many times once you can repeat?
Setting. Yes, this needs setting. This needs setting. We can use this after 15 days. After 15 days. If there is no result, you can repeat it again after 15 days.
Minimum
Ayush,
15 days. Minimum
silver.
Then how did you make that? How did you prepare that salaka? Silver
Madam, that is her bangle. Bangle, bangle. Bangle.
Children will put
Ah.
that is separate into the ministry. Starting point
When our doctor is here, he is facing tinnitus. He is facing tinnitus from long time. So we are performing this Agni Karma. We are performing Agni Karma and see the results. Just he explains his complaints and what the problem he is facing.
Hello, I am Dr. Satish. I am having tinnitus and loss of hearing on the left side since from 27 June 2019.
Shalaga.
Camera. Let's focus the camera. We are going to consider here over here. Okay. Hello. Why like this? Do you feel hot? Do you feel?
Yes.
Okay. Now this is point of Vidura Burma. This point of Vidura Burma.
Yes.
Okay. It is finished now. It is finished. Transferring. Now, we are asking about his complaints now. He is. Yes, sir. What is your feeling about the
Listen, see, I have to close my right. I have to close my right ear and I have to listen. Then only I can understand. Kinetics is there still. Sound is there.
sound is there?
Sound is there.
Okay. But what is your feeling here?
Hearing is also like that.
Okay. But you can hear.
I can hear, but
Where is your
30% I have.
Okay. Where is your partner? Can you do it in your after 15 days? 5 sittings. 5 sittings. Take my number. Okay. 5 sittings. So you have to take every 15 days. So massage.
Doctor, please side. Rajguru, please come in this side.
Low back पे आपको
आपको करना है और so please demonstrate the Zoom session also. Zoom में भी participant mic से
Hello. Everyone is looking to have a photograph of this Shalaka. It is very simple. you can do the jewelry shop. You can use that some kind of a smaller baby, Okay, you can break it into two parts. It is already having its own this round shape to hook it, so you do not have any that very this thing. I want to say ज़्यादा मेहनत करने की जरूरत नहीं है, तो अपने आप में ही आता है, तो you can use it directly. Just bring it from any jewelry shop. Jewelry shop means सुवर्णकार क्या बोलेंगे आप लोग? जो सोना बनाता है ना, हाँ, तो सोना जिसके उसके दुकान में लेके आओ, ये आपको आराम से मिल जाता है. So you can it is costing you about 500 or something like that, but it is very useful. Okay. Yesterday we are operating or we are performing rectomotion on her. As she said, she was having radiating pain. So I am going to stimulate her sciatic nerve origin. Okay, we are doing a lower back on where the sciatic nerve origin from. Listen carefully. From where the sciatic nerve comes from, we will do Agni Karma on that particular area. Being a lady, she is ready to undergo this procedure. I am thankful to her. I am very thankful to her.
Why? I don't have that pain or stiffness in the low back. I am having radiating pain.
Okay.
I start numbness and radiating pain is foot.
Okay.
It runs behind my thigh and after the foot.
Okay.
I don't have much stiffness here in the low back.
But pain is radiating.
Yeah.
Pain is
radiating.
आपको थोड़ा सा गरम लगे तो बोलिए. Yes. Yes. If it hurts you, hurt. Is this hurt? Little hurt. Okay. इसके बाद उसके ऊपर कुछ लगाना पड़ेगा ऐसे. अब ऐसे लगाना. Very nice question. That after heating, can we apply aloe vera? Yes, you can apply aloe vera. You can apply Yashti Madhu Grutha, or you can apply Shatadut Grutha after Agni Karma. It is very, very beneficial. But if you are using indirect Agni, that is passing through that Shalaka, then there is no need of using any Grutha or any Madhu or any type of aloe vera. This is indirect. If you are direct applying this Shalaka, then it is mandatory to use aloe vera, Shatadut Grutha, or any other things. Yes, very right. Very right question. That after burning, our text is mentioned that the varna becomes kapota varna. Kapota varna means it's just like a kabutar or parva. So थोड़ा सा क्या बोलेंगे जहाँ बोलो यहाँ जम्बू फल के जैसा उसका वर्ण होना चाहिए, जम्बू फल के वर्ण जैसा रंग होना चाहिए, बस इतना ही, ज्यादा उससे मत करो। अगर डायरेक्ट अग्निकर्म करेंगे तो उसमें से लसिका स्राव होना बहुत जरूरी है। डायरेक्ट अग्निकर्म से लसिका स्राव होना ही होना है, यानी कि वहां ऊंड क्रिएशन होना ही होना है। बात समझ में आई? I repeat it again. When you are using indirect heat, there is only a जम्बू फल, हाँ जम्बू फल की जैसा उसका वर्ण होना चाहिए। जब we are using direct heat, then there should be a lasika straw or there should be a water coming in from that wound. Okay, that depends on the depth you are creating there. Okay.
Migraine we can give this.
Yes, you can use it in migraine. Shown in the text.
Which place?
Like
But you have to select. That you have to select. As sir told you all the Burma points. Keep it is in mind that you have not to hurt the Burma points. So just keep away the Burma points and use this technique. Okay. One more case here. He's actually foot drop, but we are using Rakta Moksha here. I think madam is here. So, Madam Kalyani, please come forward, and you are going to perform Rakta Moksha here.
In varicose vein, we are done Siravidana. Yesterday sir had done Siravidana. In varicose vein, direct vein, we can do like that, sir. Siravidana.
Very nice and very practical question. I am very, very thankful to Dr. Tapshina. Dr. Tapshina, she is asking very good questions. Nowadays, we are having a lot of cases of varicose veins. So, in varicose veins, there is toxicity, or we are seeing that venous structure is totally broad. So, what you have to do is that you have to keep pressure over your thigh region, then your multiple punctures on that dilated veins, and you have to do all the Rakta Srava or all the Rakta motion from that particular points. Multiple punctures you have to do. Okay, then after you have to repeat it again, and this is a very lengthy process. So you should keep in mind that you are brave enough to face all the problems. Just take a needle and puncture that particular vein.
Then that blood is used out.
Definitely. On YouTube, you will get a lot of videos of Rakta Moksha.
Sir, we are having.
I have it, but there are so many doctors, they are using this technique. Very cosmetics. I will start.
What happened for do that Siravidana in that vein? We can directly go.
See, if you are an Ayurvedic doctor, I can explain everything. But if you are not an Ayurvedic doctor, it's hardly impossible to explain everything. But facility where it is dilated vein. Your motto is reducing that bulge of that vein. So when it is full of blood, you have to remove it. But we are applying this pressure over here, the thigh region. So all the blood comes from downwards. It will get occulted in that particular vein. We are removing it. We are removing all the pressure on that particular vein. So ultimately, you have to repeat the procedure again.
Why? Because now here we are giving in Kerala, we are giving more that leech in that varicose vein. In varicose vein Jaloga, we are giving different parts. So that also we are drawing that vision.
Yes, technique is same. You can use Jaloka, or you can use that needle, or you can use even number plate. Technique is same. Technique is same.
Sir, which is best?
Still, I am having doubt then, sir. We are pricking it, the blood is coming. Then it is without, no? Then how we can manage that coming blood throughout now? So with the cotton or like that, how?
It's a practical, very nice question. I am using totally freeze water. Freeze the water to stop that blood. Freeze the water. This Chitopachara. What your answer?
After how many, which time you will that sprinkle that freeze water?
After 10 minutes of the procedure is going on, if you want to stop the bleeding, then just freeze the water after releasing the pressure of the thigh. After releasing the pressure, the patabandha, what we are using that is a patta. Okay, you have to remove that patta or the pathway for the freeze water. Stop. Okay.
Sir, which is best? Sir, which is best? Jaloka or DD?
देखो आपके मन में जलौका है, ये जलौका आपके हाथ में अगर निकल है, निकल. It's your priority. It's not my priority.
Okay.
Now I don't have jaloka. I have this thing. Okay. So I am going to show you all the thing on this needles. What your point?
Thank you.
It is your choice.
Nice.
And now, sir. Sir is going to explain his problems.
I have pain in right ankle joint and knee joint. I am unable to walk more than 3 or 4 kilometers.
Doctor, you are from?
Bangalore.
This is from Bangalore. He is a practitioner. He is a foot drop. For how many years?
I am a medical officer at government sector since 16 years. I am practicing privately. 16 years.
16 years. Do you face any accident before?
Yeah. I have fractured right bundle of the TBS. 4 years back.
4 years back, he faced an accident, and after that, he is developing this condition. Okay, foot drop. Now, just observe what is the result. Is it correct? इसका ढक्कन कहाँ रखा रे? इसका ढक्कन कहाँ रखा है? क्या प्रॉब्लम? See, here is scar big scar of this exit. He has undergone operation, I think. Okay. Any blade inside? No. But here is big scar. This Aghata Jobrana. This is known as Aghata Jobrana. After Aghata Jobrana, he is facing foot drop due to all these disturbances in that muscular area or muscular structure. So we are performing Raktamokshan from common cranial vein.
एक ही कैमरा रखो उधर, क्या कर रहे हैं?
ചെയ്യാൻ പോയാൽ നാളെ ഇത് ചെയ്യാൻ പോയാൽ പത്രത്തിൽ
maximum 20 ml. इससे ज्यादा भी दे सकते हैं, 50 ml. But minimum 20. Be careful while performing all the Rakthamokshanas. You must be very careful. Look at the patient's face. If he is in agony, immediately all the needle just click on the face. Okay? This may prevent you from his muscle sugar. Put it in mouth. Okay? That is very, very necessary. Because patient may face vasovagal shock and unnecessarily you are in trouble. Unnecessarily you are in trouble. Okay? So keep in mind. क्या कोई इसको साफ करके लाएगा ये बेसिक में देख देना है जैसे सीखेंगे आप तो सीखेंगे any skin disease yes, I strongly say yes. If you are having migraine, I will do it now, right now. Right now. If you are having migraine, I will do it right now. Okay. She is not patient of migraine, but she want to learn how to do the Rakta motion. A big clap for her. Big clap for her. See, Dr. Tapshina Sari, I think she's from Hyderabad. Me from Kerala, Malappuram. Actually, she's not a patient, but she is very keen observer. Very keen observer she is, and she wants to learn how to do the Rakta motion in cases of migraine. Okay, so we are going to perform Rakta motion on her demand. on her demand. Hey, अरे सुनो यार So, on our demand, we are showing you a demo of Rattamoksha, where to do it in the cases of migraine. Okay, I used to do it, but she is not a patient. She is not a patient, but she want to show you the site exact site. So now she is ready.
This I am having more patient is migraine. That we are giving medicine, we are getting good result. Here also, here in Kerala, near to my place, there is one applying one lab is there. Before sunset, no? Sorry, before sunrise, no? Before sunrise only, they are keeping that labor on the head. Sorry, not on the forehead. And the patient will take it to room without any light. She or he has to sit in that room. That day they don't have to see the light. Only one setting, but the patient gets good result. But some patient, no, they are getting recovered. Yeah, I am having some patient like that. They have already done that treatment, but again it is recovering. So that I am having that experience. My friends and others, if one the patient, there never this recurrence is getting. That patient is lifelong cure, it is getting. So I am not having a migraine patient, but I want to know which is the point, exact point. Then only I can give the patient now. I am itself the patient. Thank you.
Yesterday, you are all well known with the site of Apanga and Utshepa Marama. So, apart from that, I am using only this type here. This type of scratches you have to do here. Okay, unless the superficial bleeders can't break. So this is the technique. Apply the syringe over here like this. Create the vacuum inside. If anyone can hold this. Now we have applied the syringe, we have applied the needle over here in piston. I have already made a ball inside the piston to make it self-retaining. Now the blood is getting collected here. After 15 minutes, it will be full of blood. Okay, this is the technique. This is the technique. Again, keep in mind that while doing or after doing this procedure, patient may face vasovagal shock, anaphylactic shock. So be careful and prepare with water in your clinic, sugar with it, just put some sugar when you feel or she feel or when patient feel some any this giddiness or something like that, you have to save patient first. You have to save the patient first. Get the point? Okay. Yes.
While doing this, now I am told
लेफ्ट राइट सिलेक्ट राइट लेफ्ट साइड
मतलब जिस साइड पेन रहेगा उसी साइड
उसी साइड
माइग्रेन बोले तो वन साइड आता है ये साइड में आता है
that is unilateral headache, that is sinusitis, you can do रक्तमोक्षण in left case यही place है second case second thing if patient is not satisfied you can apply for here also.
साइड ऑफ अपने बातों के बगल
हाँ लेकिन हाँ देखो
Maybe I'm not having migraine patient now.
It is a metabolic disorder. Don't do reproduction. It is metabolic disorder. Don't do reproduction. It is metabolic. I am also a patient of hypothyroid. Not necessary to do reproduction. She is not having any
Hello, dear, hello. What the hell? Yeah, so now we start the Burma session. So now you just.
I think my session is over now. I am going to hand over my mic to Dr. Naveen Doshi to continue with Marma points. Now lower extremity Marma is going to explain. Thank you very much for your curious learning. I am very thankful to Dr. His name? Dr. Sachin, Satish, Dr. Nagaratna, very, I think very cooperative in nature. So I am very thankful to her. And again, Dr. Patil, he is also from Bangalore, I think. Do you from Bangalore? Bellary. So I am very thankful to all of you for your curious learning. Such a word is very this thing. And again, I am thankful to Dr. This Dr. Dakshina. And also, I am very thankful to Ayush Darpan Foundation to give me an opportunity to show you all these demos. Thank you.
Thank you for the beautiful session on Agni Karma, Rakta Moksha, Nadi Pariksha, Marma Chikitsa. So much knowledge I think you have taken from this session. So now, yesterday I just given the explanation of the head Marma, upper extremity Marma, and today in the morning session I already given the explanation of the lower extremity Marma, but only lower extremity Marma and back Marma beginning. That's why I am just explaining you. I will also demonstrate practically also. So I think that in some demonstration you must have to be present here. So now come to the lower extremity Marma. So I think that again I will take the help of Dr. Vijay. Vijay ji, you just come here. And definitely I will take care, help you just sit here, and I hope that my the session is given live by the doctor. So what's your name, sir? Gopala Krishnan. He's doing also a job. Just sit here. You just sit here. But you are throwing this section throughout the world. So everybody is watching in Facebook, and you just observe the 40% are also just watching this session in Zoom also. So this is Ayush Darpan Foundation's excellent work. Give a big hand of applause to Ayush Darpan Foundation Trust, who has done a tremendous job during the COVID period also, and post-COVID era. The sequence of the this is the offline workshops we started, and actually we are doing the practical works. You observe that not a single minute of time you have wasted. And Dr. Vijay Jadhav is also observing. He is a senior person, so he is always observing everything. We have not given a single minute of time waste, and everything is practical. Nothing is theoretical. Whatever you have seen, you just see the practical. So Ayurveda is totally practical, and we are determined to prove you that the pain management techniques are also present in Ayurveda. So you observe that. So I also give a big hand of applause to the doctor who just give a demonstration on this. I think Agni Karma. Yeah, what's his name? Rakta Mokshana. Yeah, Rakta Mokshana. Beautifully Rakta Mokshana. What's the name of the doctor? I think Sriya, I think you joined from here, local Kerala. Yeah. I got your message in the WhatsApp. So very nice. So many people joined from Kerala also. I one doctor from Palakkad also. She's here. Yeah, and one I think that doctor told me that I bring some cerebral palsy cases. She is coming or not? Afternoon maybe. Okay, no problem. So now I start the marma parts of the lower extremity. So first you have to start. You have to first just look. Open your shoes. Is there? So first we start with the marker is also kept here. So first we start with the points of the lower extremity, and the main important point is the Kurcha marma. So just look, Kurcha marma, Kurcha marma, Kurcha, K-U-R-C-H-A, Kurcha, Kurcha, K-U-R-C-H-A, Kurcha. This is the 4 angular pramana point. This is our 4 angular pramana, and this is just below the great toe, just below the great toe. And how to stimulate this? This is the way of stimulation. You can stimulate in this way simply, and you find that you can find a great relief on your visual problems, alochak pitta, definitely, and relaxation. Also, you feel relaxed. And if you draw a line cutting your soul, and at the center of the soul, there is a point that is known as Pada Tala Hridaya Marma. I already explained you that this is a same marma point as you. Yesterday I demonstrated in the upper extremity. Pada Tala Hridaya Marma. This is Tala Hridaya Marma simply, but it is in the lower extremity. So this is the Pada Tala Hridaya Marma. So Pada Tala Hridaya Marma. You just stimulate this marma point like this, press it, release it, press it, release it, press it, release it, press it, release it, press it, release it. And third point is, yeah, it is half angular pramana. It is same as the upper extremity marma, so don't have to remember anything different. If you remember the upper extremity kalvada, same classification, same angular pramana, everything is same. But if you ask that, what is the difference in the clinical feature of this marma? Yes, this marma controls the activities below the navel region. The upper extremities marma controls the activity above the navel region. So always remember the two basic difference. But this marma point has also definitely a positive effect on the heart, definitely a positive effect on the avalamba kapha, definitely a positive effect on the lungs. So you can stimulate these 3 points. Third point is the Kurcha Sira Marma. Kurcha Sira Marma. Kurcha Sira Marma, if you draw this type of, I'm drawing like a brush. This is like a brush. This is at the lateral, inferior lateral area, just center to the line at the heel point. It is just at the lateral point, laterally. And this is Ardhangular Pramana. And so you can stimulate like this, this. So when we do Pada Bhyanga, what happens? We are just stimulating the Kurcha Sira, Tala Hridaya, and third Varma, Kurcha Varma. The Kurcha and Kurcha Sira Varma, there is a common property in both the Varmas. They both have a positive effect on the Alochak Pitta. You know the Alochak Pitta? It is responsible for the vision, our Drishti Prasadaka. That's why the Pada Bhyanga is explained as for the Drishti Prasadana. Means for visual, just improvement of the vision or the refractive problems, refractions, related issues, we can just by doing the Pada Abhyanga, we can just control all these three main issues, core issues. That's why we do Pada Abhyanga. So this is the three important Marma point located on the soul. It's clear? Another important thing is that the Pada Marma is directly connected with the earth. Earth. So it also controls the earth element, Prithvi Tattva, in our body. You know the Parthiv Tattva. The Parthiv Tattva is the five basic elements, you know, Prithvi, Jal, Agni, Vayu, and Akas. So Prithvi Tattva, earth element, because you know that this is always in contact with the earth. So this is very important thing. So clear all the 3 points, Urja, Urjasira, and Earth. Now come to the Kshipra. Kshipra is very important as for the Agni Karma and Rakta Mokshana purpose. And this is a Kshipra. Great toe and first toe, this is the point at the joint, this is the point, this is the Pada Kshipra. So how you have to stimulate, you can do this. So you know, in our Indian culture, when we bow our head to our elders, what we do, actually we are touching the what? Touching the Pada Kshipra Marma. And so what happens when you touch the Pada Kshipra Marma, the elders give you blessings through Tala Hridaya Marma. So energy exchange is coming. You are just receiving the positive energy from the Pada Hridaya Marma, and you are touching. Definitely the blessings and everything is coming from the elders to your Sahasrara Chakra. That is the Adhipati Marma. So all the things, whatever it is in our culture, that is not meaningless. Everything has certain meaning. So this is Kshipra Marma, and I already explained yesterday. This is same clinically important as of the upper extremity Kshipra Marma. Kshipra Marma, you already know, it is Snayu Marma. Kalantar Pranhar Marma, and it is also of half Angula Pramana. Pada Kshipra Marma has a relation with the endocrine systems. Means it also improves the libido, means sexual activities. And I already explained that the khadau, you know the khadau? When we wear khadau, that's what is called in Malayali, I don't know. Khadau. This is that is a slipper which is made of wooden and paduka, charana paduka. Yeah. Paduka. So when we wear the paduka, we just continuously press the Kshipra Marma. That's why it is mentioned that Brahmacharya and Mano Nigraha, when we continuously press this point, we just observe the Brahmacharya. Smaranam, Kirtanam, Prekshanam, Guhya Bhasanam, Kriya Sankalpo Adhyavasaya, Kriya Savedusha. 18 Astamaitanam. That is the Brahmacharya. So it controls the definitely the sexual urge and just it's I think that many Maharshis, Acharya, Yogis follow Charyas. That is the Brahmacharya. But when you stimulate this Brahma, then the cause another effect is that it is very important for treating infertility cases. Many of the cases who are taking some infertility medicines, when they take, आपको थोड़ा समझने में दिक्कत हो रहा होगा ये उधर से आए गुड्डू से कोई बात नहीं थोड़ा थोड़ा हिंदी बोलेगा है तो इधर करने से जो है वो बहुत अच्छा आता है ऊर्जा मिलता है इधर भी तो it gives a definitely positive energy to the endocrine system. That's why इससे हमारा जो है वो definitely हमारा जो heart है lungs है और हमारा endocrine system है शरीर का हार्मोन ठीक रहता है. When the hormone will be okay, then everything, our sexual health, our mental health, our metabolic rates, everything will be normal. So this is the Pada Kshipra Marma. The Siraved is also done here, nearby to the Kshipra Marma. That is very beautifully explained by, I think, Vaidya Ramesh Rajguru. Now come to the next point. It is very important. So look this point very carefully. In morning session, I already gave a demonstration of the Kulfa Marma. Gulpha Gulf. It is the same marma as of the same as of the Manibandha marma. In upper extremity, where the Manibandha marma, same in lower extremity is Gulpha. And I already explained the importance of this marma. In Durga Saptasati, it is mentioned that Gulfayo Narasinghi, Pada Pristil Tejasi, Padanguri Suratis, Pada Rastalavasili. Means the energy is located in this point, and you feel that when you stimulate this point, suddenly you feel an enlightening, just spark, just you feel the spark. So I'm just giving you how to locate this murmur. So first you have to locate, this is the gulf, this is the malleolus bone, and so malleolus bone, you have to, there are two choices. Either you can stimulate medially or you can stimulate laterally, but we prefer the medial malleolus. Which malleolus? Medial malleolus. अंदर की तरफ को करने का, बाहर की तरफ को अभी नहीं करने का है. यहाँ पे you have to identify, there is a point in which you press, then you just feel on your lower extremity, on your gulf, you can feel. In morning, already many of the participants got the demonstration, but those who are not able to participate, yes, very nice, you are doing very nicely. So you have to, what you have to do, that point which is just sparking and illuminating, you have to fix your thumb like this and make a just knuckle or key with your index finger supporting other four fingers for putting maximum pressure, as this is a Shanti Marma. So look, the Dr. Vijay is already from Hyderabad, is my student. He joined many of the offline sessions and online sessions. So he's just coming from Hyderabad for meeting with me. Many of the participants are already familiar with Ayush Darpan Digital's work during the COVID period. That's why in Kerala, we are conducting these sessions very successfully, very successfully. So this is the stimulation of the Gulf Marma. Look how Gulf Marma can be stimulated. You just stimulate your Gulf Marma. Synergy, you just stimulate your Gulf Marma. Are you getting spark? Gulf spark. So always remember that never do Marma stimulation in standing position. I am repeatedly telling you, always do it in the sitting position or in the lying down position. What happens? Sometimes the patient got dizziness and he fell down, and there may be some injury, overhead injury, other things. So avoiding that, always do it in the lying down position or in the sitting position. Never do in the standing position. Always remember, this is the protocol. So this is the Gulfum Marma. So Gulfum Marma is very beautiful. It has a positive effect on the lumbosacral area also. So in many cases where there is a disc problem, disc bulges, disc related issues, Dr. Vikas is also a student of Marma and who is doing, I think, MD in Panchkarma, and he is now in CCRS, is just taking some training on the Marma. He attended all my Marma classes, Nadi classes regularly during the COVID period. So also welcome to him also. He just joined from the Sharuturuthi, Kerala. Yeah. So this is the Gulf Marma. So the Gulf Marma is also Gulfa and Kshipra. Note down it. Both the Marma points are important for improving the for treating the infertility cases where there is erectile dysfunction, where there is loss of libido. So you can add these Marma points with your treatment protocol. Whatever you are giving, you can add these Marma stimulation. I'm not saying that only by doing this you can got the results, but you can add on with your proper line of treatment, whatever you are giving. And one thing again, I am repeating you, all the processes which you have observed in the workshop, like Agni Karma, Vidya Karma, everything has a certain invasion. We are giving some invasion. And in this, what you are observing, there is no invasion. So that is the difference. Effect is same. Like in same effect you observe by stimulating the Avarta Marma, Pangu Marma, Sankh Marma. But the difference between both the procedure is that this procedure is non-invasive. Again, I am repeating that you cannot do Rakta Mokshana in Europe. You cannot do the Rakta Mokshana and Agni Karma in Western region. There are so many legal purposes there. But you can do the Marma stimulation because this is non-invasive. So we can say that you can practice in all over the world because this is a stimulation. You are not doing any invasion. So this is the Gulf Marma. So now come to the Indravasti. So Indravasti Marma, Just sit on the that position, normal position, no problem.
How many inches, sir?
Yeah, good. 2 angul pramana. 2 angul pramana. So now come to the Indravasti marma. So just look, this is the Indravasti. You just take this marma point from the knee joint traces. It is 8 angul nearby. This is the point. 8 angul from the knee joint traces. So this is the Indravasti and how to stimulate. So I am just showing you how to stimulate. So for stimulation, you have to just do like this way, this way. You use both the fingers for stimulation, this way. And always remember that for healthy person, 5 to 8 times, and for diseased person, 15 to 18 times. Yeah, what's the question?
How many inches, sir?
Indravasti, 8 fingers. 8 fingers from the knee joints, lower margin. Angul pramana of Indravasti, half angul pramana. Half angul pramana. So this is the Indravasti marma, and the Indravasti marma has also similar effect as you learned in the upper extremity, but the difference is that this marma point is very effective in the intestinal movement. So there is a constipation or there is an apana vayu sangha, we can say avarodha, obstruction of the apana vayu. By simply stimulating this marma, you can release the obstruction of the apana vayu. But one in participant, a doctor asked me that so it may be helpful in performing the delivery. Idea one doctor given me, and she asked me, can we stimulate this marma during the procedure of the delivery? So I told her that actually we are just telling that don't do marma stimulation during pregnancy. So I never advise you to do this marma point directly during delivery process, but indirectly we stimulate these points. We don't know, don't stimulate it unconsciously, but unconsciously we stimulate these points during the delivery process, and it's apana vayu is a very essential part to perform the mutra pravritti, artava pravritti, mala pravritti, and garbha pravritti. So definitely it is the process of delivery, but I can't say because there is no such research, and I can't say because there may be some complications, so just avoid it. I just tell you. Now come to the
Can we use the pregnant lady?
which
Can we use the
no. The protocol is same. Never do marma stimulation in pregnancy. Don't ask this question repeatedly. A doctor asked me, so I'm just giving. She just given a suggestion that if we do this marma stimulation during delivery, may be helpful, but I never allow it. Second, now come to the Janu marma. So Janu marma and Pulpar marma are same. Pulpar marma, you yesterday I taught you the Pulpar marma. Pulpar marma and Janu marma are equal, same quality, same Sandhi marma, Triangula pramana, everything is same. Vaikalika marma, everything is same. But how to stimulate the Janu marma? In morning session, I already just demonstrated. There are 2 methods. If you are doing your own, then you have to do thumbs down like this. Like Dr. Vijay is putting both the fingers in the both sides of the patella. And just do it down. Just do it down. Thumbs down. Down. This is the Janu marma stimulation. So this marma point stimulation also gives you very benefit in osteoarthritis problem, joint disorders, as well as many of the people are nowadays suffering from joint replacement. They have advised that your joint is now not proper, it is not working properly, so you go to the joint replacement surgery. So by stimulating this marma, you avoid the joint replacement surgery. But if you are doing for a patient, this is for self-stimulation, then you have to do thumbs up like this. What I'm doing, just look like this. You have to just put and just thumbs up. Those who are watching in Facebook and Zoom sessions, kindly look very beautifully and carefully how we have to stimulate the Janu marma. So This is the beautiful explanation. It can be stimulated posteriorly, so I am doing it anteriorly. So this is the stimulation of the Janu Marma. So this is the way of stimulation of the Janu Marma. Janu Marma is very effective, and right Janu Marma and the left right Kurpal Marma have same effect. You remember that yesterday I told you that the right Kurpal Marma has a positive effect on liver, gallbladder. Same way, the right Janu Marma has also a positive effect on the liver and gallbladder. So if you stimulate both the Kurpal and Janu Marma, you will get more positive effects on the liver and gallbladder. Rajak Pitta. So Rajak Pitta means definitely positive effect of the bile formation also and also on the liver. In the same way, the left side Janu Marma is also very effective for spleen and pancreas. Spleen and pancreas. So same the Kurpal Marma. So Kurpal Marma and Janu Marma are same. That Kurpal Marma is in upper extremity, Janu Marma is in lower extremity. The clinical features and everything is same. The method of stimulation is different. So method of stimulation I already explained. Clear? So yeah, forearm. You know, this is triangular. Three. Kurpara is also three. Janu is also three. Sandhi Marma. So you can give a bit more pressure. The Indravasti is Mansa Marma. The Kshipra is Snayu Marma. The Hridaya is Mansa Marma. So all these are the classifications. Now come to the Urvi and Adi Marma. These are same as on the upper extremity. Take it 4 finger above, and 4 finger above is the Urvi Marma. So you just stimulate like this, and you will get the same benefit. And maximum the positive effect is on the blood circulation. You know the varicose condition. So many people are suffering from varicosity of the veins. So in the varicose veins, in the different in diabetic foot also, and in different conditions you observe that there is numbness in foot. So you find a very good results in those cases. Janu Basti, what we do, Janu Basti, we are getting the results from the Janu Marma. So Janu Marma, Indravasti Marma, as well as the Gulp Marma is a very important Marma of the lower extremity. So now the lower extremity Marma is also completed, and now I will try to give you a demonstration of back Marma. It is very important. So I think that Dr. Vijay, are you ready? No, he is not ready. So anybody else come? Vijay ji, you sit. बहुत हो गया आएगा. अभी किसी को रंग बिरंगा कराना है पीठ का. आप आएंगे डॉक्टर विजय? नहीं पीछे ये भाई कोई तैयार नहीं है. चलो रहने दो, कोई बात नहीं. मैं इसको इधर ही दिखाता है, कोई बात नहीं. मैं बिना आप आएंगे? देखो ये हमारे डॉक्टर साहब तैयार हो. एक बार ताली बजाओ. विकास जी आप इधर आके. विकास जी शायद इसीलिए आए होंगे इनको, लेकिन हम इनका ज्यादा वो नहीं करेंगे, इसको एक्सपोज नहीं करेंगे ज्यादा. आप इधर आ जाइए, इसको थोड़ा साफ करने में हेल्प कर दीजिए. यहाँ से हटाइए. विकास जी बहुत अच्छे डॉक्टर हैं, ये एमडी पंचकर्मा से हैं, और ये मेरे से बहुत associated with me from he associated with me, and he's also doing his postgraduate work in his PhD work or MD. Marma. Thesis, he is doing his thesis on Marma. So, and MD, finally MD, to give a big hand of applause to him. आगे बजा दीजिए, थोड़ा उत्साह वर्धन हो जाता है. From Parul University. Just introduce yourself.
Good afternoon all. If we have enough time, I can.
You can. This is my final lecture.
Most of the people are here from Kerala and South Zone, so you are very much connected with nature. And I don't know you believe or not, but nature cures everything. And there are two important points in your life: when you born and when you know why you born. So in first year MD, I didn't knew about any word Marma. Frankly speaking, I didn't knew about that word Marma. I only knew that there are certain tender points which a physiotherapist corrects by different methods. So during my rough discussion with my dean for selection of thesis topic, suddenly my tongue twisted and I said Marma in Ayurveda. Then in first attempt they selected my topic. then the problem arises that you have to be Marma expert for conducting such clinical study. So I first joined beginner batch under Dr. Naveed Doshi sir. Then I also joined advanced course in Marma, and then I got so deep into the subject that I joined all the Nadi Pariksha and Agni Karma. Even though I am doing Panchkarma from MD Panchkarma from my institute, then also I joined all the batches of Naveed Doshi sir. And right now I came here at CCR Institute for 1 month training of Marma for more clarity. And as my uh, as my story says that nature is pushing me towards this subject automatically. So I have a very deep gratitude for sir.
Thank you, Dr. Vikas ji. So now in the back Burma, many people, many students, participants ask that it is a very, you have to be very clear about this. So today I will just show you the back Burma. So you know this is the answer. Answer is clear. Yesterday I cleared about the answer Burma. This clear? Any doubt? No doubt. So now come to the yes, Sanjay Kumar Gupta ji, thank you. He is just giving thanks from the Zoom session. We are also very keenly observing that what 37 participants have joined this session from Zoom. So you are also getting benefits. So we are not restricting our knowledge to limited person. We try that this knowledge goes beyond the boundaries. So this is also a session live on the Facebook, and later on it will be also on YouTube. So this is the scapula. You know this is the scapula bone. So this is the scapula, and this is also the scapula. This is the angle of the blade of the scapula. You find this angle of the blade of the scapula, and at the superior medial angle, there is a point. This is known as ansa phalak. Ansa means scapula. Phalak means the angle. So Vijay, it's clear. You have any doubt, you can ask. If you came from Hyderabad to just clarify your doubt, so don't miss your doubt. So you ask if we, actually this is a very rare opportunity because I am available here offline. So this is the superior medial angle of scapula. If you just draw and measure it from the fingers, you find it is 4 fingers, both laterally, both sides. 4 finger distance from the spinal cord. Clear? But so this is the superior medial angle. So how you stimulate this point? You have to do this. You have to do this. Actually, always remember not do it in standing position. I'm just demonstrating. That's why I'm doing. So clear. This is the answer phalak. So it is very important. It acts on the answer shosha, manasa shosha. Our bahu. Means a person is not able to lift his hand, you can do this point. So then the second point is the brihati. Brihati name itself indicates a large size marma. Brihati. Brihati is located at the inferior medial angle of the scapula, 3 finger above. 3 finger above. If you find the inferior medial angle, this is the inferior medial angle. You just any of the patient, you can find this angle, and 3 finger above this point is the brihati. This is the brihati. Why the name brihati? The brihati, you know that when we give sabas, oh good, well, you are doing very good, and where we just put our this hypothenar evidence at the brihati. In Kerala, I expect Sanoj is not here. The master Sanoj and others, what they do the just close this point of this neck marma, and the animal got just unconscious, and after 15 or 20 seconds they put like this, and again the animal regain the consciousness. Means definitely by stimulating and hitting this marma, the recharge means, so that's why in cricket also you observe that when bowler take a wicket, the captain comes and just press the brihati point. So everything is associated logically with scientifically with the Burma. This is the brihati point, and brihati has a very large area, so it acts up to the Manipur chakra. So you will get benefits up to the Manipur chakra, means in the kidney and bowel, everything comes under the range of the Brihati Marma. So it is clear now? Brihati. Now come to the Parsandhi. Parsandhi. So Dr. Vikas, just put like this. Yes. This is the renal angle, and if you look, the thumb is coming just at the lumbosacral area. Lumbosacral area. And the renal angle which is covered, it is just kidney, suprarenal gland, and all the glands, endocrine functions related to suprarenal gland, adrenal gland. You know that adrenal gland releases adrenocorticoids, glucocorticoids, mineralocorticoids. So it is a positive effect on these definitely positive hormones. So this is a very effective. So how you can see it? Just put yes, just press it, like press it and release it. Yes, press it and release it. And when we do the Ardha Ustrasana, just we bend our body from through this karma point. So yoga people already do it. So is it clear? This is Parshu Sandhi karma. Now come to the next point. It is known as Nitamba. Nitamba. So Nitamba is just from where your buttocks start, means at the wing of the ilium bone. Ilium, ischium, and pubis are three bones which makes the pelvic girdle. So it is at the starting point of the ilium bone, that is known as the ala of the ilium. So this is located at the ala of the ilium, that is the wing of the ilium. It is very effective for the pelvic disorders. It is very effective for the lumbosacral region problems. So this is the Nitamba. Nitamba. So if you want to detail, I will share the notes. Everything is given. What is the Angula Pramana, type of karma? You just remember it, but you just practically identify this point. This is the Parsandhi. This is the Nitamba. If you measure the distance between Parsandhi and Nitamba, it is 8 Angula Pramana. 8 Angula Pramana. From here, 4 and 4. 8 Angula it comes. This is known as Nitamba. Clear? Nitamba. You understand? समझ में आ रहा है? Are you getting what confusion? Just come here. Parsandhi is here. Renal angle. Renal angle. This is Parsandhi. And Nitam is here. Where buttocks starts. This is the floating ribs. Just look. This is the floating rib. Don't confuse. Whatever confusion, you just clarify it. This is the Parsandhi and this is the Nitam. The distance is 8 angula. So this is the Nitam. Below just Nitam, 4 fingers below the Nitam, there are 2 notches. That is known as Kukundara. 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 Just below the Nitam, this is the point. This is known as Kukundara. Kukundara is also a very important point. Sundar Marma yesterday, I think that when Ramesh Rajguru already explained the Kukundara's word. The Kukundara Marma is there. It is also a positive effect on the pelvic region, Apana Kshetra, the reproductive organs. If all Marma points are related with the blood formation, definitely an Artha Vasukas as well as the Supravasukas. So this is the Kukundara. Kukundara. Kundera. And the last one is the Katika Taruna. Katika, yeah? It is 4 finger. 4 finger below the Nitam. 4 below the Nitam. Now identify the Katika Taruna. Simply, Katika Taruna is very easy. You can identify it. Just put your shoes and this where the ankle comes and touches on the hip. That is the point that is known as Katika Taruna. If you sit on the Vajrasana, you find that your ankle just come on that point. That is known as Katika Taruna. Katika Taruna. आप कर सकते हैं ऐसे पैर मार के खड़े हो जाइए ना वो आता है खड़ा होना ऐसे खड़े होकर दबाइए जहां पे मिल जाता है that is the point that is known as Katika Taruna. The name itself indicates Kati means pelvic region. Doctor, Kati means pelvic region and Tarun means what is the meaning of Taruna? Huh? Young, Jawan, Yuva means the name itself indicates the clinical feature of this man. If you want to solve your pelvic problems, Katika problems, you have to sit on the Vajrasana. You have to stimulate the Katika Taruna. So the Katika Taruna. That's why the whole of this area, the pelvic area, is a very important area. So we perform the Kativasti. So Kativasti also we get the results of the Kativasti directly from stimulation of this Katika Taruna. So today I explained Kurchasir Marma, Kurcha Marma, Padakala Hriday Marma, Gurfu Marma, Indravasti Marma, Janu Marma, Ani Marma, Urvi Marma, and from the back region, Ansafala, Brihati, Parshandi, Likam, Ukunda, and Katikam. Any question? Huh? Oh, Krikatika. He wants to know Krikatika. Subsequent language. Yeah, good, very good, very nice. So only one point of there is a Krikatika is remaining, and the Krikatika. So I just explained the Krikatika. You know, the Krikatika is a word used for the this cervical vertebra. So Krikatika, if you look, this is the occipital bone, and this is the starting of the neck. Where your occipital bone ends, and from where the neck starts, there is a 2 point that is known as alento-occipital joint. This joint is known as alento-occipital joint. So if you are performing Krikatika, please. You were performing the Krikatika Marma of patient, then you just come on the back side and just do like this. Just look like, just come here. You can see. Just on the video. Simply, you have to just press it, press it, press it, press it. And if somebody is doing his own Krikatika Marma, you have to make a lock. Just lock another. Yes, and just press through hypothenar eminence. Just press through hypothenar eminence. Like this, like this, like this. So many of the participants who asked me about the cervical problems. So cervical problems, this Marma is a very good Marma. This is already the Sandhi Marma in the this area, half angular Pramana, at 2 in number, and you have to, if you are stimulating your own, so follow this position, and if you are performing the stimulation of another person's, then you have to do this way. So now all the Marma points has been covered, and practically the practical effect has been demonstrated. So is there any question you can ask? I am asking. Yeah, okay. So you actually the front reason Marma usually we don't stimulate it. Actually it has a yeah. Actually the Stanamula, Stanarohita, Hridaya, Apastamba, Navi, Asti, these are the Marma points of the front reason. So these Marma points is indirectly stimulated in the massage. Legally and ethically, we cannot stimulate the Stanamula, Stanarohita, Hridaya Marma of anybody else. As the Hridaya Marma is Satya Pranadhara Marma, Basti Marma is also Satya Pranadhara Marma, Navi Marma is also Satya Pranadhara Marma, and Buddha Marma is also Satya Pranadhara. So these Marma's stimulation should be done indirectly. How indirectly? So Buddha Marma is by doing Aswini Mudra. Basti Marma is by doing Urmasana. I already shown you. The Navi Marma is by doing Mandukasana. And Hridaya Stanamula and Stanarohi is by doing this like this. This is the Hastabardha Vaksha Mudra. You can just do the CTR technique. So indirectly you stimulate. And so all the front Marmas are just covered. So Hridaya, Navi, Basti, these all are the silver Marma. Yeah. And Kanta Marma, we never directly stimulate this Marma. So I just put showing the location of the Kanta Marma. Just behind, just at the lateral side of the vocal cord, there are 2 points. These Marmas known as Neel Dhamani. Neel Dhamani. So Neel Dhamani, just immediately lateral to the vocal cords. Now think about that. If you are doing some massage or some stimulation over there, and accidentally the patient got a heart attack or cerebral attack by own cause, what happens? The whole responsibility comes under you. Attendant will not scare you. You eat your food. You tell you have done something wrong. That's why my doctor, my patient is now not able, or she or he got heart attack or a cerebral attack. Whatever. So avoid this clearly. Don't do this. So this is Neel Dhamani. So, and at the mandibular angle, just put your fingers at the mandibular angle to find there is a pulsation. This is the manya. Manya is related with the honor. So it is related with the Udana Vayu. So this is Manya. And the 4 points, 1, 2, 3, 4 here, and 1, 2, 3, 4 here, both sides, it is Sira Matrika, which those people who are just pressing this continuously to animals and the animal got unconscious. If you press it for 20 or 30 seconds, you find that the blood supply to the brain, yes, don't do it. Please don't do it. These are doing by the Kalari, Kalari people. Also, many people are there, at which they are just pressing continuously this point and obstructing the blood supply of the brain. Definitely, consciousness goes just diminishes, and the animal got unconsciousness. Then, after 15 or 20 seconds, they just hit the brihati part, and again the consciousness will resume. But don't do it. So, this marma points of the neck can be stimulated by positive pressure and negative pressure technique. How the positive pressure and how the negative pressure? So the pipe blowing or the sunk Panchakarya blowing, in every process we already stimulate this marma in indirect way. So this is the stimulation of neck. Any question?
Blowing.
Yeah?
Blowing.
There are 2 marma points in the drawing is in, they are Lohitaksha and Vitap. So usually we don't stimulate these points. Vitap is just near to the perineal. जहाँ पे हमारा scrotum आता है नीचे, inguinal canal, there is the point which is known as the Vitap. So whenever we sit on the Siddhasana, Vitap, V-I-T-A-P, Vitap, it is related with the Shukravamstrotas and Arthavamstrotas, and it is mentioned in Shastra where you give an injury to the Vitap marma, it leads to Shandatva, means the infertility or sterility. So that's why many of the sadhu and yogi perform to pray or to for tapasya, they just sit on the Siddhasana position. In Siddhasana, they just press the Vitap marma continuously, and that's why their Shukravamstrotas are obstructed, and so that's why yes, like this sitting in Siddhasana, this part is press the Vitap marma. So in Padmasana not, but in Siddhasana you press the Vitap marma, and when you do performing the Vrikshasana, where you put your this lower extremities, the ankle, like you are able. Yes. So this comes on the Lohitaksha marma. So this is the Lohitaksha marma. 2 months. Yes. So this is the marma of the groin region. Vrikshasana. So I think that maximum of the marma point I covered. So any question you can ask. So this lecture is now finished. I think that was time now. 1:30. So Ramesh ji, can you demonstrate anything more? You can come, and half an hour we again join continuously for this session, and after that the lunch break will be. And after lunch break, the felicitation session and the participant distribution session will be. Therapeutic aspect of the marma is all the marma concept, Dr. Vikas. The therapeutic aspect of all these marma, you can find a good effect on the back problems, the spinal problems, spinal regions, spinal bifida, the bulging of the spine. The Gulf marma has a very positive effect in vascular necrosis. Definitely, so many positive effects on the problems related with the spinal cord as well as of the lower extremity. Yeah. अभी उतना सीखो, सब भूल जाओगे. You forget everything. Akshadar is asking about the Akshadar and Lohitaksha. So I will explain it to you. Okay? Any question?
Which was used to
CP. CP child will come. I will demonstrate. आएगा ना वो मरीज में दिखाएंगे कैसे करनी है. अभी patient आ रहा है. Patient is coming. Yeah, we will demonstrate on the patient. So now we start again the practical session. Where there is Rajguruji. I don't know what hand over the mic to you. Thank you. आपको क्या करना है? Okay, meet repeters. Just introduce yourself. Many of the
Now, just starting before this session, this madam concerned me, and she has some problem. Now she introduced herself and tell you on her problem.
I'm Dr. Meghna. I have the severe crepitus and both in the joint. While I'm sitting down and up, I'm feeling the severe crepitus. It is audible, very much audible. That's why I seek the help from sir. I do already the Agni Karma in my both knee. but I feel some feel better, but I want to cure it very clear. So I ask help with the surgery.
What she tells that she feels crepitus on both knee joint. So I'm going to perform only stimulation of the Janu Marma with the help of needle number 24 by half, 24 by half on particular points. Please carefully observe the procedure. Okay. Don't come near. You can observe from your seat. Okay. Not necessary to come forward. Actually, all the procedure should be done in lying down position, but due to lack of this space, we are just giving you demo. We are giving you demo. This is the procedure. Yes, we can.
Actually, what happens? No, that camera will be. Can't see here. Yes. Okay. Is this okay? Is this okay? Okay, is she visible now?
Yes.
She is a good model for you. Little massage over the knee is very, very necessary. Okay. Take your another balance. This procedure is known as Vittha Karma. Vittha Karma. If you are not finding any opening of the vessel or vein, then you can use this technique in your patients. Okay, this is known as Vittha Karma. Okay, so and in the cases of arthritis, osteoarthritis, with the karma, we have to give Snapan to the patient up to 10 to 20 ml Tiratain daily. 10 to 20 ml Tiratain daily for 2 or 3 months. It is beneficial for doctors and it is beneficial for patients also. It is beneficial for doctors and it is beneficial for patients also. Remember how that you have to take a bottle of 20 ml of Tiratain, just have to save it for your benefit. And it is beneficial for patient, for he is getting a good results. Now, Dr. Meghna is going to tell you about her emotions after the treatment.
Sir, Telatel means English name.
She is going to express something. She is very happy.
Time of treatment's okay, but the computers and I just
Sit down. Sit down. Yeah, see. Sit down again. Say this in mic.
I feel like repetitions come when I sit down, like the break of the half an hour to 1 hour. I will regularly feel this much sound.
Why you are not receiving the call?
And the second, can I speak in Malayalam? Sweet, okay. Anyone just translate the Malayalam like okay. എനിക്ക് ഈ ഒരു പെയിന് റെഗുലർ ആയിട്ട് ഈ കമ്പ്യൂട്ടർ സൗണ്ട് ഉള്ളത് തന്നെയാണ്. ഇപ്പൊ ഞാനിപ്പോ ഇരുന്ന് കഴിഞ്ഞാൽ, അതായത് ഇപ്പൊ ഞാൻ ഇരുന്ന് കൊണ്ട് സൗണ്ട് വരും. ഇപ്പൊ സെക്കൻഡ് സൗണ്ട് വരില്ല. ഒരു ഹാഫ് ആൻ അവർ ഗ്യാപ്പ് ഞാൻ വീണ്ടും ഇരുന്നാൽ എനിക്ക് ഇതേ സൗണ്ട് പെയിൻ. അതൊരു റെഗുലർ ആയിട്ടുള്ള ഒരു ഇതാണ്. ഞാൻ ഇപ്പൊ സാർ എനിക്ക് വിത്തകർമ്മ ചെയ്തത്, എനിക്ക് തന്നെ സ്വയം അഗ്നികർമ്മം ഞാൻ ചെയ്ത ഒരാളാണ്. ഞാൻ ചെയ്തപ്പോ ജസ്റ്റ് ഒരു എന്താ മൈന്യൂട്ട് ആയിട്ടൊന്ന് കുറഞ്ഞു, ബട്ട് വീണ്ടും ഒന്ന് റീസ്റ്റാർട്ട് ചെയ്തു. പക്ഷെ ഞാൻ നമ്മുടെ ഈ അഗ്നികർമ്മത്തെ കുറിച്ച് ഡീറ്റെയിൽ ആയിട്ട് പഠിക്കാൻ വേണ്ടി നോക്കിയപ്പോ അതിനകത്ത് ക്രപ്പിറ്റർ സൗണ്ടിന് വളരെയധികം റിലാക്സ് അഗ്നികർമ്മം ചെയ്താൽ കിട്ടും എന്ന് പറഞ്ഞു. സോ ഫോർ മൈ ക്ലിനിക്കൽ ട്രയൽ ഞാൻ എനിക്ക് തന്നെ ഒരു സെൽഫ് ട്രയൽ ചെയ്തതാണ്. അപ്പൊ എത്രത്തോളം റിസൾട്ട് ഉണ്ട് എന്നുള്ളത് സാർ പറഞ്ഞു. തിലതൈല പാനം ചെയ്യണമെന്ന് പറഞ്ഞു. സോ എനിക്ക് ഒരു തിലതൈല പാനും മസാജും സാറ് വിത്തകർമ്മം ചെയ്ത പോർഷനില് ഈ മർമ്മ സ്റ്റിമുലേഷൻ ചെയ്യുന്നതിനോടൊപ്പം നമ്മൾ ഈ തിലതൈല പാനം ചെയ്ത് കഴിഞ്ഞാൽ എത്രത്തോളം റിസൾട്ട് ഉണ്ടാവും എന്നുള്ളത് ഞാൻ നമ്മുടെ ഗ്രൂപ്പിൽ പോസ്റ്റ് ചെയ്യുന്നതായിരിക്കും.
And she is very brave girl. I congratulate her. I am very thankful. So I am taking her number personally for her results. Okay? In front of all of you, I am taking her number. Thank you, Dr. Meghna. Okay, thank all of you for your patience. She has to repeat it again and again because both the needs are her own. She has to do it on her own. I have just demonstrated all the points. She has to do it regularly with the Snapan. Snapan is very must because all the sound is due to increase of water inside her joint. So water stopakrama first is Sneha. First is Sneha. Sneha means Tirtela. The great is Tirtela. Tirtela is sesame oil. Okay?
How can we know that the result is because of that Vitanama only? By taking Viratera, it Vata Shamana takes place.
Definitely, we have to do Vata Shamana. Second, come forward. Please come forward. You and Dr. Meena, I think you are from the same place. Are you from Kerala? Karnataka. So, is this needle having some hole inside? There is a bore in 26.5. Actually, this needle is used for giving insulin to diabetic patients. Okay, but here we are using this needle to evacuate vayu inside her knee joint. So when she sit down for the first time, you all actually heard all the sound of her knee joint. But when second time she get down, there was no sound. Now we are requesting her to do the same again, and we are going to observe. Don't please do not speak. Please do not speak, because she is now doing the thing what I say. Second time there are no sound. Okay, so can you do it in your home? If your mister is doing, so I don't have it. Okay. She said that I can do it in a home. Okay.
Sir, please, Dakshina, please keep it, please, sir. Leave it.
But previously,
I don't know whether that is true by MR or something. I heard this one to do.
Correct, more books.
I'm learning complete.
Yeah.
What the doctor? Dr. Nandini is asking a question that it is effective in osteoporotic patient. I can say it is definitely effective in osteoporotic patients. Definitely effective. Do it and compare the results. Very nice question, very practical question. I definitely call patient for follow after 10 days, and I repeat the same procedure again and again. After 10 days, for 2 months. For 2 months, just Snehapan and with some Ayurvedic medication, patient gets beautiful results.
Sir, in these problems, you perform like or that thing. How it will be like it is not a symptom which is only for pain management. How you substantiate that Agni is a complete treatment?
Very nice and very beautiful question. Very good question. Actually, what's doctor's duty is to give complete relief from pain. Pain is the prominent symptom. So whatever the pathology inside, I forget about all the pathology. So I want to give pain relief first. Then I go to the root cause of that particular patient. If patient is ready to do further panchakarma, that like basti or for gadivasti or for raktamoksha, so I decide myself on that particular criteria with all the medications, and if patient is not agree, so I forget all the treatments. So whatever the samprapti or whatever it may be, so it depends on patients. This thing, yeah. No, रिलीफ तो होना ही है उसको, लेकिन अगर उसका अगर फीडबैक करने को मिलना है तो उसका पेशेंस रहता है, क्योंकि how much time he want to pay you, okay, how much time for 6 months he is unable to pay, for 1 time, for 2 times he is enough, but for every 15 days you are asking for money, definitely your patient will go away from you. So first and second time it is enough, far enough, but continue, it is not necessary for doctor and for patient. So please, if you are doing panchakarma, do it very clearly and clearly convince your patient that you have to undergo all this treatment, then you will feel better. Is this answer? Okay?
Since I studied on
There is Vimarka, but you have to evaluate the problem and you can perform raktamoksha in that particular patient also. I have one patient, he was having severe ischemic heart attack. I performed raktamoksha because of I was very far away from taluka place or tahsil place. So I performed 250 ml raktamoksha instantly. After that, the patient was getting sorbitrate in physician's clinic. He diagnosed him as an inferior ischemia, inferior wall ischemia. Then that patient shifted to Ahmednagar town. In that 4 hours, patient was all right. After 4 o'clock, patient get streptokinase in the hospital. Then patient was survived for 5 years. After that, patient undergone bypass surgery, and after bypass surgery, within a month, patient collapsed. So we can perform raktamoksha in ISD and deep vein thrombosis also. This is my experience. I think comparatively you are very newcomers and you are very newer in this field. But after some years, when you get such type of experience, your confidence will definitely gain. And I definitely pray to Lord Dhanvanti
for your good experience in the field of Ratnamokshan, Vittakarma and Agnikarma.
Which place you done the Ratnamokshan? Ratnamokshan is scheme with others. Which place you done?
Very practical and nice question. Actually, at that time, I used cubital fossa for Ratnamokshan of Sarvadic Ratnamokshan. For Sarvadic Ratnamokshan, I use cubital fossa. The vein is very prominent, and I take near about 200 and 250 ml blood out of the particular vein, and the patient feel all right. Then I shifted to hospital. But it was not my job because I'm not a cardiac physician or cardiac surgeon. So my limitation was this much. So calculating all this risk, I shifted to patient to hospital. Our limitation, we must know all the limitations of all, and ourselves, we are not taking too much risk. I am also not taking too much risk. Okay, because all the patients or all the participants between you are willing to perform this procedure on their own, and they are actually what satisfaction are they are getting. I don't know, but I think they are very happy to learn all the kriyas. Okay.
So can we perform Agnikarma and Ratnamokshan in the same patient or the same time or?
Practical question, very practical question. Appreciate the question, but if you are doing Ratnamokshan, you are doing Dhatukshan. So do not perform next Agnikarma. Do not perform it. Give some time. Because this is live body. Okay? All the cells are live cells. Live cells. And we are our experiment are being on live patient. So give some time, 10 days interval or 15 days interval, and they do set another Agnikarma or Ratnamokshan. But if you performing Ratnamokshan with Agnikarma, that is definitely dangerous for you also and for your patient also. So keep a distance, keep a gap between two karmas.
One more. Nowadays we have pottery machines. Some doctors have seen video. They are doing Agnikarma with that electric pottery machine.
Electric cautery machine.
Yeah.
Electric cautery machine. That is choice of yours. That is choice of yours. If you are electric cautery, you can use. There is no problem at all. But you have thermal cautery. Just I show you. There is thermal cautery. You can use it, no problem at all. But it is a part of practice. It is a part of practice.
So what about watts?
There is chamaki. That you can use that electric cautery. Electric cautery. Electric cautery is very beneficial in watts, not this cautery. Agnikarma, you have to use that electric cautery or gynic cautery. What you answer?
So where do the gold slaka, silver slaka?
That is your choice. If you want to earn more money, you can use gold shalaka. If you want to use minimum money, you can use lower shalaka. You can use mritika shalaka. You can use just waste of cow. The ajashakrut. The goat, waste रहता है ना goat का. It is also useful. Even I use that mosquito repellent. You know that tortoise coil. Tortoise coil for Agnikarma. It is continuous burning. It is easily available. I use it because Yojana Sastra बाहर, जो हाथ में है वही शस्त्र बनाओ, जो हाथ में है वही शस्त्र बनाओ। ऐसा कुछ नहीं है कि यही चाहिए वही चाहिए, ऐसा कुछ नहीं। You got answer? I think very nice session and very practical questions you are asking. I am appreciating all your questions. And I think I have fulfilled your this queries. If any query?
Sir, what are the precautions? Jaluka Charna, precautions what we have to take?
It is already mentioned in the text. It is already mentioned in the text. The Savish Jaluka, Nirvish Jaluka. You have to identify Savish Jaluka. Then three karma of Jaluka Vacharan. Paschat karma of Jaluka Vacharan. It is already stated in the text. Go through the text. I don't use Jaluka. Never. I never use the Jaluka in the practice. I never use Jaluka. So, because of her appearance, patient fears that something is going to apply on her or on him. So he never accepts it. So the Jaluka, I never use. Interrupter, I will show you personally. Yeah, I have a patient. Just I have a video. Okay. No, very practical question. Very practical. If we are putting that particular shalaka on that particular heat, it is direct. It is direct anti-venom. But we are keeping that away from that particular this thing, point of the shalaka. We are using heating the base of the shalaka. It is indirect agnikarma. And direct agnikarma, we are heating that tip of the shalaka. Tip of the shalaka. Same. This same. No, she's not okay. It's a careful procedure. So you have to convey the patient first.
Stimulation will be different for several.
Nothing different. Same stimulation you can get by indirect, or same stimulation you can get by direct. Okay. Now, Sir Vijay Jadhav.
So I think that lunch is also now ready. So I request all of you to the next session, the validity session, and participants will get the certificates. Yeah. So you just come for the lunch. Thank you. Yeah. Thank you for joining, and thank you all the participants from Zoom also joined from Zoom. And many of you. Thank you. Thanks to all of you. So after a short break of lunch, and then we again join here. Thank you. Thanks to all of you, Jignesh and many of the participants who joined from Zoom. And just watching this.